Welcome back to the Med Madness podcast, where we dive deep into the intricacies of medical science to help you ace your USMLE exams. I'm your host, and today we're exploring the fascinating renal and urinary changes that occur during normal pregnancy. Let's delve into how the maternal body adapts to the increased demands of pregnancy, focusing specifically on the renal system. During pregnancy, the body undergoes numerous changes to support the growing fetus. One of the most significant changes occurs in the cardiovascular system, with increased cardiac output and blood volume. These changes are essential to meet the rising metabolic demands and to prepare for the anticipated blood loss during delivery. Consequently, these cardiovascular adaptations lead to significant changes in other maternal organ systems, including the renal system. Next, let's discuss the renal system. One of the first changes is an increase in renal blood flow. This enhanced perfusion ensures that the kidneys receive sufficient blood to filter the increased plasma volume. Along with this, there's an increase in the glomerular filtration rate, or GFR. This means that individual glomeruli are filtering greater volumes of plasma, which is crucial for maintaining homeostasis during pregnancy. As a result of this increased filtration, we observe decreased levels of serum blood urea nitrogen, or BUN, and serum creatinine. It's important to note that while the production of BUN and creatinine remains relatively constant, their serum levels drop due to the increased GFR. For instance, a serum creatinine level of 1.2 mg/dL, which might be normal in a non-pregnant patient, would indicate significant renal insufficiency in a pregnant patient. In pregnancy, the normal range for serum creatinine is much lower, typically between 0.4 to 0.8 mg/dL. Moving on, another critical adaptation is the increased permeability of the renal basement membrane. This change leads to greater urinary protein excretion. In fact, it's normal for pregnant women to excrete up to 300 milligrams of protein per day in their urine. So if a urine dipstick test shows trace amounts of protein, it's generally considered normal in the context of pregnancy. Given these renal changes, it's vital to closely monitor and adjust medications that are renally excreted. This ensures that the medications remain effective and safe for both the mother and the developing fetus. Pregnancy also brings about leukocytosis, which may be a response to inflammation. However, if there's marked bandemia or significantly elevated lymphocyte counts, further investigation is warranted. Additionally, while urinary protein excretion increases, there's also a physiological change in blood volume. During pregnancy, total blood volume expands, but plasma volume increases more than red blood cell mass. This causes a mild dilutional anemia, which helps protect the mother in case of postpartum hemorrhage. The laboratory definition of anemia varies by trimester, less than 11 g/dL in the first and third trimesters, and less than 10.5 g/dL in the second trimester. Platelet counts, on the other hand, are usually normal or slightly decreased. Some women may develop gestational thrombocytopenia, which typically resolves after delivery without the need for further evaluation. To illustrate these points, let's look at a real-life case study. Sarah, a 28-year-old woman in her second trimester of pregnancy, presented with concerns about her renal function. Her primary care physician noted that her serum creatinine level was 0.9 mg/dL. While this level would be normal for a non-pregnant individual, it was slightly elevated for Sarah, indicating that her kidneys were working harder to filter the increased plasma volume. Additionally, her urine dipstick test showed trace protein, which is expected during pregnancy due to the increased renal permeability. Understanding these physiological changes allowed her healthcare team to monitor her condition closely, adjusting her medications to ensure both her health and the health of her baby. Thank you for tuning in to this episode of Med Madness. I hope you found this deep dive into the renal and urinary changes during pregnancy insightful. Remember, understanding these physiological adaptations is crucial for managing the health of pregnant patients. Stay tuned for our next episode, where we'll explore more fascinating topics to help you excel in your medical journey. Until next time, keep learning and stay curious.